And what was your most memorable experience during your presidency?
Well, really, when I think about the fact that I was elevated to the presidency, having gone through uh, 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 handling the educational program at Hilton Head for George Popkin, who was one of my mentors at New York University, Skin and Cancer. And so it was quite an honor. So when I think about the American Society of Dermatologic Surgery, I really have a flotilla of memories that occurred when I first met at NYU many of the originators of the society. George Popkin was one of my mentors, as was Norman. Yes, Norman Orntrike. And actually, George Popkin had been working with a very close friend, a plastic surgeon, and so as a first-year resident, he was teaching us grafts and flaps at elementary level, which was really most unusual.
That was groundbreaking for dermatologists to be doing flaps and grafts.
Right. And then George went on to send out a pamphlet on once the organization was active. Every 2 months, the top papers that were presented by our members. So really, it was just a great guy to lead me as a new matriculate in dermatology.
Well, that's great. Yeah, what other sort of innovations were happening at that time in dermatologic surgery?
Well, of course, through Norm Orntrike, he was my other mentor, and for 3 years I had both George and Norman leading me through my 3 years of residency. And so not only did I become quite skilled in dermabrasion, which Norm had helped develop, but with George, we had the advanced surgical techniques. Because if you recall, in those early days, dermatologists, their surgical skills were really a desiccation and curettage of basal cells and keratoses. And so we were in a new field of development. Methotrexate had come along, first by Dr. Reese in San Francisco. And so liposuction also came along in 1984. And so we dealt with that.
Yeah. What kind of issues that were going on with the society? What were the main issues at that time during your presidency?
One of the main things was that we, as a new society, I guess at that point we were 1970, we were 15 years in, we were still trying to accredit ourselves with a standard that would be accepted by not just general medicine and physicians in the general medical field, but our own dermatologists. We wanted them to be aware that we were really quite talented and knowledgeable through training to perform many of the things that they'd formerly sent to either general surgeons or the plastic surgeon. Mm-hmm. So it was very important. The other thing that happened is that Ed Kroll, who had been the president in 1983, followed by Henry Rennick in 94, and I in 84, and I was 85. We had put together a program to be, hopefully, that the heads of departments would pass on and educate our residents as they came through training. And of course there was reluctance because many of the heads of departments were senior people, and they had not been aware of our development for skilled surgery. So we worked with that, and it was that year that finally we published a booklet, and with Ed Kroll and Henry Rennick and me, we approached our friends who were heading up departments all over the country. We were helped particularly at the University of Miami, where they actually named the department as dermatology and dermatologic surgery.
Was that the first department to do that?
Yes, he was. And that was Harvey Blank, who was a dear friend. And of course, I lived in Georgia, and Harvey and his wife, Nancy, used to come to hike at our area. So I got to know him personally. And of course, I had known him at his research activities at the University of Philadelphia, University of Penn, rather. Mm-hmm. And so we had a great deal of friendship and respect. And so Harvey, when he renamed the program there with dermatologic surgery, it was very significant.
Oh, for sure.
And then Henry Jolly, who basically operated in Tulane, lived in let's see, Henry was from Baton Rouge. He also, being very active member in the ADA, American Dermatologic Association, spread the good word. So politically, we had some good people working in our behalf to be recognized. And so that was the year that the program for dermatologic residents for surgery training was accepted, and then things got better from there.
It was groundbreaking. That's when it all really got pushed forward. It's amazing. Thinking back on your career with your patients, are there any patients or a patient who sort of sticks out in your memory as being, particularly memorable?
Well, the years I spent in Norm Orentreich's office, we saw a lot of Broadway stars and starlets, and that was the year that we had worked with injection therapy for alopecia areata, which became subsequently the standard of care. But in Atlanta, Georgia, the practice had many CEOs from around the world, big companies, and so there were a lot of important people. One particular case that stood out in my mind was the CEO of one of the major aircraft manufacturers came in with a lesion on his thigh, medial thigh, that looked like a seborrheic keratosis, classical. But in shaving it off to do a shave biopsy, the specimen came back with a level 3 melanoma. So we basically at that point proceeded, and he lived without any trouble with adequate surgical excision. So it was pretty impressive that a almost misdiagnosis went on to save the life of a very important individual.
Let's see, in looking back in your careers, anything that you would have done differently or changed?
Well, truthfully, although I was newly married, I would have, I think, taken a year to go on for Mohs, and probably at that time laser was getting quite active. I think I would have taken an extra year of training, because not necessarily to do Mohs, but Mohs surgery opened up from the wounds they created, opened up a new level of surgical initiative and development for all of us, because we learned to really close major wounds. And of course, in the beginning, they were not that skilled in doing closures and flaps, but the impetus was there for they to improve, and in turn we improved, all of us.
Now, were there many Mohs fellowships at that time, and were they a year long, or were they just more like a month or two?
Well, it was interesting to me, because when I went into practice, I left as a instructor at NYU, because I wanted to do both the private practice and continue in education of dermatology. But at the time I went to Atlanta in 1957, there were 3 Mohs surgeons in the country. 4. Frederick Mohs from Wisconsin, who taught Perry Robbins the procedure, and then Henry Benn at University of Miami or University of Florida. And then in Little Rock, there was Tom Jansen. So when I had the occasional cases that we couldn't cure, massive lesions, and we needed a Mohs surgeon, I would have to arrange for my patients to go to one of those three cities. Now, of course, in Atlanta, Georgia, of course, this is forward to 2019, we have something like, I think there are 30 Mohs surgeons in Atlanta, Georgia.
That's amazing. Wow. What advice would you give today's young dermatologic surgeons?
To continue to read the literature, stay in journal clubs so that you can exchange ideas, not just with the American Academy of Dermatology Journal, but our very fine American Society of Dermatologic Surgery Journal. And to consider advanced training. Of course, the courses here at our yearly meetings, now in our 49th year and going up on 50, to stay active there, to try whenever possible to be on the staff of not just hospitals, because that's important. Even though 99% of our surgery is done in our office, the interaction with surgeons and physicians in general is very important. So join a hospital staff, even if you're not going to use it other than attending the general meetings, but to impress our conferees in medicine that we are skilled and knowledgeable and really the best source of derm care, both surgically and medically.
I think it's very important as we're such an outpatient-based specialty that we do stay involved.
Right.
It's great advice. What are your predictions for the future of dermatology and derm surgery?
Well, if we stay as well educated as we should, staying active in our Society of American Derm Surgery, and staying active in our own communities, and hopefully having the opportunity to teach residents, because we all know that the teacher learns a lot more from the students, and for preparing for the various talks and consultations he's going to give the residents, he's going to be a better dermatologist and a better dermatologic surgeon.
Very true. What advice do you have for the leadership of the ASDS?
Well, I've been extremely impressed with the activities and how well we've done, and particularly this year's meeting of course, it's amazing how beautiful we've become as a society. The women, I think, now make up 55 to 60% of the attendees, and they presented papers, and they've been good active listeners as well. So it's the society's doing well. I would just hope, from what I've seen at this meeting and the last 15 meetings I've attended, that we have all these wonderful dermatologists and dermatologic surgeons, but we really should remember that we are primarily dermatologists. We should still provide the medical care that we're so capable of, and not think only in surgical terms. I mean, what we're doing is wonderful, and we've come a long way, but we're a little overloaded in cosmetic concerns, and that's not what we were trained at. And we need to remember our histopathology and our dermatopathology. I know at Skin and Cancer, 25% of our time was spent in dermatopathology. And we had people like Arthur Hyman and Ackerman Bernie who came along, who kept us skilled and involved. And we need to be able to look at the slides that we get, or should insist upon getting, from a dermatopathologist, so that we maintain that capability that we all have. So a little less cosmesis, and continuing to be good clinical dermatologists.
Great. Awesome. Anything else you want to add?
I'm sorry?
Anything else you want to add or say? Or?
No, it's
Great.
I've been honored to be associated with the group, and along the people that I worked with were littered. I have a lot of senior moments, mind you, but he and was one of the founders, and it's just been a great ride, and I'm happy that we formed the society back in 1970, and that we're continuing to do a good job.